New York State has just released new guidance for school districts. This guidance is coming from the State Department of Education rather than the Department of Health, which said just last week they would not be providing reopening guidance. Allie Peters joins us now live from the newsroom with more on this. Allie, what are we learning?
Well, Adam, schools have been asking for this guidance from the state for a very long time. And while some local districts like Penfield and Greece have already released their own guidelines, these recommendations from the New York State Education Department will help guide many districts who haven't released their plans just yet. So here are some key takeaways. First, masking, which is recommended indoors for all teachers, staff, students, and visitors, regardless of their vaccination status or community transmission levels. Masks are also required for passengers and drivers of buses, again, regardless of vaccination status. The CDC is no longer recommending temperature screenings or screening questionnaires at school. Now, in terms of social distancing, the CDC says schools should maintain 3 feet of distance between students and classrooms. 6 feet is recommended between students and teachers who are not fully vaccinated. Physical distancing is not required, however, on school buses. Daily disinfection is encouraged in school buildings and buses at least once a day. Now, the CDC recommends schools to reopen fully for in-person learning as long as local public health officials agree. Providing remote learning is something they're leaving up to local school districts. Other key points of the guidance were people who are fully vaccinated do not need to quarantine after coming into contact with someone who had COVID-19 unless they have symptoms. It was also noted that if schools need to close due to COVID, schools should be ready to provide remote instruction or increase distancing. Now, as for sports and extracurricular activities, masks are recommended for indoor events. The CDC is also strongly encouraging COVID-19 screening testing for student athletes and those in extracurricular activities. The guidance also said high-risk sports and activities should be virtual or canceled in areas of high community transmission unless all are fully vaccinated. Live in the newsroom, Allie Peters, News 8.
Allie, thank you. This is all happening as Monroe County officially reaches a high level of COVID-19 transmission. The CDC considers anything over 100 cases per 100,000 residents in a 7-day average to be high risk. Well, in Monroe County, we are now seeing an average of 104 cases per 100,000 residents. We are the first and only county in the area to hit that threshold. So, why the rise? For one, we know the more contagious Delta variant is spreading, with health experts saying it makes up for more than 90% of our local cases now. We also have less than 60% of our total population vaccinated, but health officials say we've also become a little too relaxed.
And, we said, okay, we can go without masks. We can do this. And we got very relaxed. And the problem is that everybody wasn't vaccinated while we were relaxing. So now we're seeing the ramp up in infections, and we're seeing the stressors on our hospital systems. And we don't want those stressors on our hospital systems. We want them to be able to take care of the people with the heart attacks and the strokes and all those other things.
Wayne, Orleans, Seneca, and Yates counties are listed now at being substantial risk of transmission, while Geneseo, Livingston, Wyoming, and Ontario counties have a moderate risk of transmission. By the way, for all the very latest on state school reopening plans and the continuing rise of COVID cases in our area, just head over to rochesterfirst.com.